Well, always time for one more story. Now, at the Global Citizen Concert in December last year, the United States of America pledged an historic commitment of $1.2 billion to fighting HIV and AIDS. And through its agency, the U.S. President's Emergency Plan for AIDS Relief, or PEPFAR, the funds will be used to help those who are suffering most from the disease. And we've invited back U.S. Global AIDS Coordinator Ambassador Deborah Birx to give us an update on the pledge. And it's always good to have you. Thanks for coming back.
Thank you very much for having me.
And we did say we would continue to talk about this, and I'm glad that we've managed to keep our promise. But let's just get an update. Since that pledge was made, what has happened?
So that was $1.2 billion just for South Africa. So we have put over the last 16 years $75 billion into sub-Saharan Africa, because that's the epicenter of the HIV epidemic. But the majority of the infections, 7.5 million, are here in South Africa. Headed to 8 million by 2020. And with Mozambique's 2 million, 10 million HIV-infected individuals, primarily adults between 25 and 45, right here. Almost 8 million right here. And I think we pledged that money because your president made the announcement that they needed to put 2 million people on treatment. We endorse that because that's the minimum. That's the minimum to get some control of this epidemic, which continues to spiral out of control. That now didn't translate completely down to the health centers that interact with the clients. And that's why we're back really cautioning on the availability of the U.S. government funds. It has to be a now, but from the president down to the clinic where we're serving our clients together.
And do you find that that message is cascading down in any effective way?
We found it was not. So when you look at people who have come to the clinic, have made that effort, the 25-year-old who missed a half a day of work, they sit in queues for 5 and 6 hours. The clinics are chaotic. So more people are leaving treatment than we're getting on treatment. This is a true disaster, because once someone finds out they're HIV infected and has internalized that and is willing to come forward and get treatment to save themselves and to not transmit the virus, and then we don't provide an opening, welcoming environment at the clinic, and we lose them within the first 3 months or 4 months of starting therapy, this is a tragedy, and it's a tragedy for all of us to really confront. And we're confronters. We look at the data and we say this is not working. And so I think immediately the Minister of Health has put out a circular, has met with the MECs this week, and has said we have to have a now. We're going to lose an entire generation of productivity. That's what's at risk, the very fabric of South Africa and its ability to move forward. When you have 8 million, nearly 8 million adults infected with HIV, you're losing the ability to move forward as a nation. This has to be treated as a crisis. And I think to all the moms out there, I'm calling on the moms, because the moms will understand. And to all the moms that are listening, if you have a 20 to 45-year-old son, find out if he's been tested. Find out if he's on medication. Find out if he's protected. Because what's really happening with the men, they're presenting so late that their immune system is already destroyed. HIV is like a cancer. It eats away at the inside, and by the time you had symptoms, so much of your insides are destroyed that we can't bring you back to full health. So this is a fallacy that you can just take drugs. If you take drugs when you're first diagnosed and stay on those medications, you will survive and thrive. If you stop them, the virus rebounds. You don't feel different, but it's destroying the inside out. And I think that's it's a message we're trying to get out. So moms, help us. Moms, protect your 15-year-old girls. Make sure they understand how to confront sexual violence. Make sure they know how to say no, the aunties and grannies. Let's get the community mobilized to ensure that no 14, 15, or 16-year-old is raped. There's so much we can do together. We were excited. We want that excitement to go all the way down to the communities that we serve together.
By judging what you're telling us, that picture rather gloomy down there. But you have been in the country now for some weeks compiling a report. As you say, you get off on the data and confronting these issues from that perspective. But what are some of the other revelations that you found in just working at that level?
It's been really exciting the last 3 weeks, and we thank South Africa for welcoming us into South Africa. We've had 26, now 30 countries who have come and met about their plans for next year. It's nearly $4 billion that we have been planning just down the street, planning to have the most effective program in collaboration with two critical pieces: governments, but the communities and civil society, the voice of those who are truly at risk for HIV, and ensuring that we're listening to both voices to really plan a strategy and invest where we're going to have the biggest impact. We now see on the continent countries that have succeeded in controlling their pandemic. That's very exciting to me because they provide a roadmap of what's possible.
Which countries are those?
Namibia, Ethiopia, Rwanda, Kenya, we believe, is approaching this. Nigeria just released their new data showing that their epidemic is almost half what we thought it was. I mean, this is what's possible, both by getting the right information, like in Nigeria, so now we can confront the epidemic that they do have. But these countries that have made this tremendous progress, we've started to dissect why have they? And it's a very simple answer. From the Minister of Health down to the health worker that's serving that community, they are dedicated to saving the next generation. That's the difference.
Well, Deborah Birx, promise to have you back.
I'll be back.
Definitely, because this is an important subject, and I think we need to keep our finger on the pulse here.
And let's go to a clinic together and see if those clients are being served with compassion and with openness.
That's an idea. But thank you so much, as always, for stopping by. U.S. Global AIDS Coordinator, Ambassador Deborah Birx, talking to us there. We're going to take a break and...